Over the past 3 weeks, Heather Burgiss has taken a critical look at a growing mental health crisis in North Carolina. In part 3, Heather looks at possible solutions to the top 2 roadblocks the mentally ill face on a possible road to recovery, those being long and frequent emergency room visits and serving jail time.
In North Carolina and across the country, statistics show that more and more mentally ill people are finding themselves behind bars instead of in treatment.
If you go into some of the major jails in this country, you would be appalled to see that they're mental hospitals, and not very good ones.
A national study shows that 17% of the jail populations across the country have a diagnosed serious mental illness. Among that population, 72% have a co-occurring substance abuse problem.
So what you're seeing is very alarming rates of incarceration, in part because our treatment programs have shrunk. Our laws are more restrictive and more apt to pull into the net people who are largely committing nuisance crimes, and then they end up in the criminal justice system.
Dr. Marvin Swartz is a professor and division head of social and community psychiatry at Duke University School of Medicine. He is a national source on research examining the effectiveness of services for the severely mentally ill. Dr. Swartz believes the lack of psychiatric beds and community support services are a large part of the crisis for the mentally ill.
There's a lot of people who just can't live in safe neighborhoods where they're away from violence. If you're living in a neighborhood and you're not able to be employed and you're mentally ill, there's an awful lot of opportunity for mischief or substance abuse, and so you get arrested.
We haven't done a great job at providing the support for people long term when they need it. So if somebody leaves a jail, for instance, that's going in because of a minor crime that has something to do with their substance abuse or a mental health issue, we need to follow people better. We make sure we're in their lives in a supportive way so that we help them get re-engaged in their community.
And follow-up community support programs for the mentally ill have shown to have a positive impact on how many times a person with mental issues returns to jail or the ER. In a national study featured in the American Journal of Psychiatry, the mentally ill who were served by assisted outpatient treatment showed major reductions in alcohol and drug abuse, as well as dramatic decreases in psychiatric rehospitalization, arrest, as well as homelessness, suicide, and episodes of violent behavior.
Somewhere between 60 and 65% of our population has a mental illness. If you include substance abuse in that, we've got 80 to 90% of our population has a substance abuse problem or mental illness.
In Charlotte, when the Mecklenburg County Sheriff realized that close to 80% of his inmates had some type of mental illness or substance abuse issue, he made it his mission to make the Mecklenburg County jails therapeutic, with unique programs and counseling, and the results, a lower return on inmates to the jail after release.
Everything we do is focused on rehabilitation, and we take a holistic approach. We do not look at an inmate as a mentally ill person or a substance abuser or someone who doesn't have a high school diploma. We look at that person holistically.
Karen Simon is director of inmate programs and shows us the unique model of incarceration that seeks to support a transformation for each inmate, mind, body, and soul, through counseling, education, and trades like carpentry, culinary, and horticulture. Simon says the groundbreaking programs are making a difference.
I often say our facilities are healing centers. People that have never been in our jails don't quite get that, but when they come to our jails and they experience what a positive environment is, what a therapeutic environment it is, and the energy that you will feel when you're in our jails is one of love, compassion, support.
Mecklenburg County carefully follows each inmate after release, but in other areas of our state, there's often no follow-up plans for care, and the majority of the mentally ill end up back in the emergency rooms. A report on state hospital admission delays across North Carolina shows an estimated $7 million is spent boarding people in emergency departments every year.
You need alternatives to going to the emergency room, so you need really high quality and comprehensive services out in the community so that people won't see their only alternative as being in the emergency room.
An example of an alternative to an ER visit would be at UNC Wakebrook, a mental health recovery center that opened its doors in 2013 in Raleigh. Wakebrook provides crisis and assessment services, short and longer stay residential inpatient services, and medical detox and primary care.
All of Wake County's patients that are from the magistrate involuntarily committed make their first stop here unless we're on diversion. And we try very hard never to go on diversion. This is the only clinic that's open 24/7. So patients come here, they do not need an appointment, and we see anyone that comes in. So since I've been here, the youngest we've seen has been age 3, and the eldest has been 80.
Many have looked at UNC Wakebrook as a good model for the crisis care needed in communities across the state and to remove burden from emergency departments. But still, Wakebrook often has to close its doors because of demand.
For example, today 7 discharges out of 16 patients, and I imagine that we'll be full again by noon tomorrow, if not earlier. So there's a huge demand.
Interestingly, no, we've had even a bigger problem with children. So about 20% of the people we see here at our crisis and assessment unit are 17 or younger. Oftentimes people will wait for days or even more than a week to get a bed.
In this state, we have a severe shortage of mental health child psychiatrists. In some counties, none, in some one. But invariably, across the state, there are often long waits to see a child psychiatrist.
Another challenge for North Carolina is that 28 counties currently don't have a single psychiatrist. But according to a recent study by the North Carolina Center for Public Policy Research, telepsychiatry, the use of teleconferencing equipment between doctor and patient, is improving outcomes for people with mental illness.
Program that we design is when a patient shows up in an emergency department, and this is an emergency department where there is no psychiatrist available on a 24/7 kind of a basis, then this program steps in and sees that patient.
Dr. Saeed is a professor and chairman of the psychiatry department at the Brody School of Medicine at East Carolina University. He says the use of telepsychiatry in emergency rooms to link a psychiatrist to a rural area or other helps triage long stays in the ER for mental illness. Because of the need, the General Assembly has funded the statewide telepsychiatry program, or NC STEP, for $4 million over the next 2 years.
It's effective, efficient care close to their home without the stigma of putting in some kind of a police car and transporting someplace.
As many look for more solutions to the current crisis of mental health services in North Carolina, those closest to the issue say people continue to suffer a system in serious trouble, but treatment has never been better. So they believe there is hope ahead.
We're excited about putting out measures that, although they may not improve overnight, we're committed to putting that out because we have to, it's the first step that you do is you have to admit you have an issue, try to work on it, bring people together around a common solution, and I believe we have that chance to do that.